In this video, a dissection review of the anterior and lateral leg regions and the dorsum of the foot will be presented. This work was conceived by Carlos Andrés Suarez-Quian and Joel Valensky. Carlos Andrés Suarez-Quian will narrate the video. Let's start. The leg is the region of the lower limb that extends from the knee to the ankle. When we break a leg, we're specifically referring to either the tibia or fibula, or both. Horrific leg fractures that occur in violent sports, such as football, may ultimately lead to amputations because the fractures tend to be compound fractures accompanied by infection. Let's start the dissection of the anterior and lateral leg. The anatomical leg is shown in the image. The region that extends from the knee, indicated by the patella and the patellar tendon, and that extends to the ankle, indicated by the lateral malleolus. As we all know, the anterior aspect of the tibial shaft, beginning at the prominent tibial tuberosity, is subcutaneous, and thus impact of this part of the leg with solid objects causes significant pain. The muscles that dorsiflex the foot generally originate from the lateral aspect of the tibial shaft, the interosseous membrane, and the fibula. These muscles are contained within what is referred to as the anterior compartment of the leg. The three muscles of the anterior compartment of the leg are the extensor digitorum longus, extensor hallucis longus, and tibialis anterior. They all have a common function in dorsiflexing the foot. Having discussed the muscles of the anterior compartment of the leg, we must now describe their innervation. The common fibular nerve is a major branch of the sciatic nerve that passes superficially along the neck of the fibula. We discussed this branch previously when we described the branching of the sciatic nerve into a tibial nerve and a common fibular nerve. The common fibular nerve then splits into superficial and deep branches. The superficial branch innervates the two muscles in the lateral compartment of the leg, the fibularis longus and brevis. Here's a finished dissection of the lateral compartment of the leg. Note, the tendons of the muscles pass posterior to the lateral malleolus and will plantar flex rather than dorsiflex the foot. Examining the tendons of the muscles found in the anterior compartment of the leg as they travel to the dorsum of the foot, we can observe from lateral to medial the fibularis tertius, that is somewhat detached part of the extensor digitorum longus that inserts into the fifth metatarsal, the extensor digitorum longus tendons, shown here as they pass across the dorsal aspect of the foot to insert into the distal phalanges of the lateral four toes, the extensor hallucis longus, extending to the proximal phalanx of the big toe, and the tendon of the tibialis anterior that runs lateral to the medial malleolus and extends to the medial cuneiform bone. Note also that this dissection is still superficial enough that the dorsal venous arch is still present. The medial aspect of the arch will ultimately become the great saphenous vein. As with the hand, the foot also has intrinsic muscles. Displacing the tendons of the extensor digitorum longus and the extensor hallucis longus reveals the muscle bellies of the extensor hallucis brevis and the extensor digitorum brevis. Also note in this image the dorsalis pedis artery. This artery is a continuation of the anterior tibial artery onto the dorsum of the foot. The pulse of this artery is used clinically to assess blood flow to the lower limb. Looking now at the dissection on a different foot, The superficial fibular nerve continues onto the dorsal surface of the foot to supply most of the surface and the lateral toes. The previously described dorsalis pedis artery is also labeled, and one can see it extends to the big toe. The medial toes, in contrast, are supplied by a terminal branch from the deep fibular nerve, and thus the integrity of this nerve can be assessed by determining if the patient responds to light touch in the interdigital space between the first and second toes. This now concludes the dissection of the anterior and lateral leg.